Cystic Fibrosis Foundation Compass presents Navigating CF, a series of informational videos for people with CF, their families, and caregivers. In this video, we take a look at Medicare, CF, and major health transitions. You'll find additional videos and more information in the Understanding Medicare series on the Navigating CF playlist, including a video specifically about Medicare and transplant. Some people with CF may require coverage for additional services such as oxygen, management of CF-related diabetes, tube feeds, long-term care, or even hospice. As you assess Medicare plans and options, consider how these potential transitions could affect your life. For example, one transition might include the need for oxygen. Medicare will help pay for it, but there may be things to work through with your care team. Original Medicare covers home oxygen therapy as durable medical equipment, or DME, under Part B, when certain requirements are met. Unless a physician orders oxygen to be used 24/7, Medicare will pay for either a portable or a tank system, not both. Medicare Advantage plans must cover at least as much as original Medicare covers, but specific coverage and costs will vary from plan to plan, and providers may be limited to those in the network. Medicare covers home oxygen therapy as part of a 5-year contract. Medicare pays a monthly rental fee that includes all equipment, oxygen, supplies, and maintenance for 36 months of that 5-year contract. Likewise, as a Medicare beneficiary, you pay 20% of the monthly rental fee for 36 months. For the last 24 months of the contract, the medical supplier bears all or most of the costs of providing home oxygen. If you need oxygen, it's crucial to work closely with your care team to identify appropriate suppliers that can meet both your needs and Medicare's requirements. For example, oxygen suppliers are required to provide both stationary and portable solutions for Medicare beneficiaries if medically necessary. However, not all suppliers carry portable oxygen solutions that a person with CF may be prescribed or prefer. So, it is important to know a supplier's portable solution options before signing a contract. If you have CF-related diabetes, or CFRD, it's helpful to know what Medicare pays for and what your financial responsibility will be. Starting in 2023, the Inflation Reduction Act limited the cost of insulin to $35 per month for those who have Medicare. This includes if you use an insulin pump. If you give yourself insulin injections or use an insulin pen, these are generally covered under Part D, and the copay is capped at $35 per month of supply, as long as the insulin product you take is covered on your plan's formulary. That's the list of covered drugs. Supplies such as needles, alcohol swabs, gauze, or testing strips and lancets are only covered at limited quantities or may not be covered by your plan at all. A 2023 expansion to the Continuous Glucose Monitor, or CGM's, coverage policy includes all people with diabetes with any type or manner of insulin treatment. Under this updated policy, Medicare beneficiaries with CF-related diabetes will have increased access to CGMs. Cystic fibrosis is a supported diagnosis for home tube feeding, but getting coverage for formula can be challenging based on where you live. This is particularly true if you are able to eat by mouth during the day. Supplies may have limited coverage on original Medicare and some Medicare Advantage plans. If you have feeding tube needs, connect with your CF care team or Compass to better understand your specific coverage. Some people with CF may be interested in long-term care options. Under Medicare, long-term care has very limited coverage under Part A. It's up to 100 days total at a skilled nursing facility, also known as a nursing home, under strict medical necessity review. Those who are dual eligible with both Medicare and Medicaid get coverage through Medicaid beyond Medicare's 100-day limit. And if there's a need for hospice benefits, the hospice organization must be Medicare approved, and a doctor must certify that the person has 6 months or fewer to live. If you receive hospice care in a facility, most charges are covered, except for daily room and board. For hospice services at home or in another outpatient setting, you will have a small copay for each prescription of pain and symptom management medication. CF medications may or may not continue to be covered under hospice care. Finally, Medicare will also cover short-term respite care for a primary caregiver. If you're considering hospice care, discuss these and all other concerns with the hospice organization and your care team. You'll find detailed information and resources about Medicare and major health transitions on cff.org/insurance. And remember, Compass case managers are here to answer questions you may have about these and other special considerations related to Medicare with CF.